What is acupuncture? Acupuncture is the most well-known aspect of Chinese medicine and may be used alone or in conjunction with herbal medicine, moxibustion, the heating of specific acupuncture points using the herb artemisia, or tuina, Chinese massage. It is likely that the acupuncture practitioner will also offer dietary and lifestyle advice or suggest a course of exercise. Each of the organs of the body has its own associated channel or pathway of energy. These are often referred to as meridians. Very fine needles are inserted into points along the meridians with the aim of bringing the body to a point of balance and harmony. Every aspect of the patient's life is considered by the practitioner before the points are selected. Sometimes it may be impossible to change someone's life circumstance, but by using acupuncture the person may be strengthened so that they are more easily able to deal with what life brings their way. A visit to an acupuncturist will usually take up to an hour, with the needles being left in place for 20 to 25 minutes of that time. Very often people go into a state of deep relaxation whilst the needles are in place and many drift off into a brief but sound sleep. Acupuncture is widely known for its effectiveness in treating musculoskeletal injuries but has traditionally been used extensively in the treatment of respiratory, digestive, gynecological, and many other chronic conditions. What can acupuncture help with? The recent spin-off article regarding acupuncture and ACC contains information that is incorrect. Acupuncture NZ response to spin-off article by Daniel Ryan and Jonathan Harper 20/6/20. The very first statement of the recently published article Poking Holes in Acupuncture by D. Ryan and J. Harper is untrue. Why then should we believe that any of the rest of the article has any credibility? According to Ryan and Harper, the World Health Organization pulled its support for acupuncture in 2014. On May 7, 2020, the president of Acupuncture NZ, Robin Kerr, received an email from the World Federation of Acupuncture Moxibustion Societies, WFAS, which reads as follows: the World Health Organization will hold the 147th session of the Executive Board on Friday, May 22, 2020, at 12 o'clock, said. As an NGO in official relations with WHO, WFAS is invited to send delegates to this meeting. Please kindly find the invitation as attached. That does not sound as though support for acupuncture has been pulled. Nor does the statement on page 27 of the WHO Traditional Medicine Strategy 2014 to 2023. TCM practices vary widely from country to country, with certain practices, sometimes called modalities, regarded differently depending on the culture, understanding, and accessibility of conventional medicine. A practice where significant progress has been made is acupuncture. Although acupuncture was originally a feature of traditional Chinese medicine, it is now used worldwide. According to reports supplied by 129 countries, 80% of them now recognize the use of acupuncture. In their article, Ryan and Harper again use their favorite quote that acupuncture is theatrical placebo. What they overlook in their quoting of ACC statistics is that only about 45% of the treatment provided by Acupuncture NZ members is claimed through ACC. The rest attend the clinics throughout the country and pay for the treatment themselves. Acupuncture is being used extensively in hospitals throughout the world, particularly in those who provide care for patients with cancer. This was very clearly demonstrated in the 30-minute Acupuncture Now Foundation documentary Getting to the Point about children at Orange County Children's Hospital receiving acupuncture to assist in their treatment of different forms of cancer. The University of Texas MD Anderson Cancer Center in the U.S. has incorporated the use of acupuncture into the treatment programs of many of their patients. Because acupuncture and Chinese medicine is a complete healthcare system, there is very little that does not benefit from a course of acupuncture, herbal medicine, or a combination of both. Very often it is possible to combine the best of both East and West and use the acupuncture or Chinese herbs in association with treatment provided by a GP or other healthcare provider. New Zealanders are increasingly turning to their local acupuncturist or Chinese herbalist for answers to their questions or assistance with their health and well-being. Historically, Chinese medicine was used as an aid to maintain good health and included not only acupuncture and the taking of herbal medicine but also the importance of diet and lifestyle choices. The types of conditions people visit their acupuncturist or herbalist for include digestive disorders, indigestion, reflux, irritable bowel syndrome, fluid retention, headaches, migraine, tension or cluster headaches, hypertension, asthma, hay fever and sinus conditions, coughs, colds and flu, menstrual disorders, irregular, painful or heavy periods, some forms of infertility, male and female, maintenance of well-being throughout pregnancy and preparation for labor, morning sickness, heartburn, constipation, headaches, lower back pain, breech or posterior presentation, recovery after childbirth, breastfeeding difficulties including mastitis, postnatal depression, prolapse conditions, emotional support, menopausal symptoms, hot flushes, insomnia, night sweats, bladder irritation, volatile emotions, musculoskeletal disorders, arthritis, back pain, strains and sprains, carpal tunnel syndrome, tennis elbow, bursitis, general sporting injuries, polymyalgia rheumatica, fibromyalgia, neurological conditions, trigeminal neuralgia, shingles, Bell's palsy, phantom limb pain, multiple sclerosis, Parkinson's disease, psychological disorders, post-traumatic stress disorder, anxiety, depression, skin disorders, psoriasis, eczema, dermatitis, acne, scarring. The Acupuncture Evidence Project was published by the Australian Acupuncture and Chinese Medicine Association in 2017 and revised in 2018. Their researchers, John MacDonald and Stephen Jans, compiled an extensive list of current research on acupuncture treatment of a wide variety of conditions. Insurance and ACC information. ACC. All members of Acupuncture NZ are recognized by the Accident Compensation Corporation, ACC, as treatment providers. Once a claim has been accepted by ACC, you may choose to visit a recognized acupuncturist for your treatment. It is not necessary to be referred to an acupuncturist by your GP, physiotherapist or other health provider. Your practitioner may also prescribe Chinese herbs, but ACC will not cover their cost. Most practitioners will charge a co-payment for ACC treatment. Acupuncture is very effective in treating acute injuries. In general, the sooner the injury is treated, the better the result. Studies show that acupuncture is effective in reducing inflammation and swelling, so early treatment of an injury may considerably lessen the time needed for recovery. People who receive acupuncture for an acute injury frequently report that they feel considerably calmer after treatment, as well as reporting a reduction in pain. If the injured area is inaccessible due to a plaster cast or dressing, acupuncture points can be chosen above and below the site to treat the injury. Because acupuncture points occur on both sides of the body, the uninjured side may be needled to effect treatment. Work and Income New Zealand, WINZ, with a referral from a GP, those who are registered with Work and Income New Zealand, WINZ, may be eligible for some assistance with payment for treatment. Health insurance. The following insurance companies and organizations recognize members of Acupuncture NZ and will reimburse some of the cost of treatment. Southern Cross Medical Care Society. Acupuncture is covered under the Wellbeing Plan, which allows for up to $400,000 per year for acupuncture treatment. Health Service Welfare Society, HSWS, PSIS healthcare only for those who had policies beginning prior to 2004. EBS Healthcare, Education Benevolent Society. This insurance covers those in the education sector who are a member of their union. The following organizations also cover all or some of the cost of acupuncture treatment for their employees: NZ Police, Air New Zealand, Kiwi Rail, and Veterans Affairs. Other modalities. In addition to acupuncture and Chinese herbal medicine, a visit to the traditional practitioner may also involve the use of a number of other less well-known treatment methods. Moxibustion, moxa, refers to the warming or heating of individual acupuncture points or regions of the body by burning the herb artemisia close to or actually on the inserted needle. The heat is able to penetrate deeply into the muscles and essentially strengthens the actions of the needles. By drawing more qi and blood into the area, moxa can greatly aid the healing process. It is the burning of moxa which gives many acupuncture clinics their characteristic aroma. Cupping, the application of vacuum cups to the skin, most commonly used on the back to increase the flow of qi and blood to the area. Cups frequently will leave circular bruises on the skin, but these will not be painful and will clear after a few days. Tuiana, a particular style of massage used by traditional practitioners. With or without oil, the practitioner will massage the different areas of the body using a variety of techniques, frequently following the meridians or on specific acupuncture points. Gua sha, the practitioner will scrape the surface of the skin using a smooth blunt-edged tool, causing localized redness. Frequently used in the treatment of children but also for adults, particularly to relieve the symptoms of the common cold. Tai Chi, specific sequences of gentle exercise, again utilizing the meridian system. Tai Chi may be prescribed as an addition to acupuncture or Chinese herbs, or alone to move or strengthen Qi in order to benefit organs or muscles. Qigong, specific breathing exercises and gentle movement, again prescribed to move and strengthen Qi. Diet and lifestyle advice. The practitioner of Chinese medicine looks at the quality of foods quite differently than a Western dietitian. The energy of the food is considered rather than whether it contains protein, carbohydrate, or fat. Some foods are considered to be warming, therefore are more appropriate for cold conditions or to eat in the cooler months. Cooling foods are better eaten in summer or to reduce symptoms of heat in the body. Appropriate foods which would assist the healing process may be suggested, whilst at the same time advice may be given as to which foods may be exacerbating the problem. Frequently asked questions. Is acupuncture suitable for me? Acupuncture can be used to treat an enormous variety of conditions, from sporting injuries to digestive upsets or even the common cold. Anyone from newborns to the elderly can benefit from a course of treatment. Acupuncture is a very safe and effective form of medicine with a history of many thousands of years. It can be used not only for the treatment of conditions or illnesses but also to help keep you well and prevent illness taking hold. What should I do before treatment? It is better to avoid drinking coffee or eating a large meal immediately prior to acupuncture, but don't arrive at the clinic feeling really hungry, or under the influence of alcohol or drugs. Cigarettes, caffeine, or recreational drugs make it more difficult for your practitioner to accurately diagnose your condition. What happens during a typical treatment? Chinese medicine is a holistic treatment, and your practitioner will take an extensive case history, covering every aspect of your health, diet, and lifestyle before making a diagnosis. This may include asking seemingly unrelated questions about such things as your response to changes in the weather, your menstrual cycle, even if the condition you are attending for is not related to your cycle, or whether you sleep with your feet out from under the blankets. Your answers will help identify patterns of disharmony, which will allow your practitioner to make a more accurate diagnosis. Your practitioner will also take your pulse on both wrists and may ask to look at your tongue, as both provide valuable information about your constitution and presenting condition. After making a diagnosis, your practitioner will decide the appropriate treatment. This may be acupuncture or Chinese herbs separately or in combination, or may include the use of moxibustion, tuiana, or gua sha. Your practitioner may also make recommendations regarding your diet and lifestyle. In comparison to needles which are used for an injection or to take blood, acupuncture needles are very fine, not much thicker than a human hair. A typical treatment will involve the insertion of 8 to 10 acupuncture needles into points which may be selected either close to the affected area or as far away from it as possible. The needles must stay in place for approximately 20 to 25 minutes, during which time most people drift into a state of deep relaxation or may even go to sleep. Will it hurt? Most new patients are amazed how painless acupuncture is. The thought is worse than the reality. When the correct stimulus of the needle has been obtained and the qi has been activated, the patient may feel some heaviness, distension, tingling or electric sensation either around the needle or traveling up or down the affected energy pathway or meridian. What should I do after a treatment? Energetic changes in the body will continue for some time after the needles have been removed, so it is preferable to avoid any strenuous activity immediately after treatment. To avoid undoing the effects of the treatment, it is also better not to consume any alcohol or recreational drugs. How will I feel after acupuncture? Depending on the type of treatment you have received, you may feel very relaxed and calm, or you may feel revitalized and more clear-headed. It is not unusual to feel like resting after a treatment, and occasionally your symptoms may flare for a short time before settling. Generally, the effects of the treatment will be more obvious the following day. Should I tell my doctor? Yes, it is possible that a course of acupuncture may reduce your need for some medications, so it is essential that your GP is aware that you are receiving treatment. Most medical doctors are supportive of acupuncture treatment, and it is better for you if all your healthcare practitioners are able to work together. Should I tell the acupuncturist of any medications I am taking? Yes, when taking your history, your practitioner will ask you about any medication you are taking. Many pharmaceutical drugs have noticeable effects on the pulse, and as this is one of the diagnostic tools used by your acupuncturist, it is important that they are aware of your medications. It is also possible that some of your symptoms are side effects of the medication you are taking, and it is helpful for your practitioner to be alerted to this. Should I continue to take my medication whilst having acupuncture treatment? It is very important to continue your medication. There can be serious consequences from suddenly stopping some pharmaceutical drugs. Whilst it is possible to use acupuncture to reduce the need for some medications, this should only be done in full consultation with your GP. Is acupuncture treatment covered by ACC? Yes. ACC has recognized Acupuncture NZ members as treatment providers since 1990. Once you have had a claim accepted by ACC, you can then choose to go to an acupuncturist for treatment. It is not necessary to have a referral from your GP or other treatment provider, the choice is yours. It is not appropriate for any other treatment provider to suggest that you should not have acupuncture treatment for your injury. If this is suggested, then please let Acupuncture NZ or ACC know so that this can be followed up. It is important to note that ACC will only cover the treatment of a specific injury. You should not expect your practitioner to treat conditions other than your injury under ACC. Why should I go to a member of Acupuncture NZ for treatment? Members of Acupuncture NZ are required to meet the highest entry-level qualification of all acupuncture practitioners in New Zealand. They are also required to complete 20 hours of continuing education every year in order to maintain their annual practicing certificate, and must abide by the rules and code of professional ethics of the organization. If the acupuncturist you choose is a member of Acupuncture NZ, then you can be sure that you are in the safe hands of a competent practitioner. Is acupuncture safe? Acupuncture is extremely safe when practiced by a qualified practitioner. After 4 years of full-time training, members of Acupuncture NZ have an in-depth knowledge of Chinese medicine and the meridian system, as well as anatomy and physiology from a Western medical perspective. All members of Acupuncture NZ must use sterile single-use needles and abide by the clinical guidelines of the organization. Occasionally a small bruise may occur at the site of the needle insertion, but this is not usually painful and will clear in a few days. How do I choose an acupuncturist? By choosing a member of Acupuncture NZ as your acupuncturist, you can be sure that you are in the safe hands of a well-trained and qualified practitioner. To find a practitioner close to your home, go to the Find a Practitioner facility on this website. Most Acupuncture NZ members also advertise in the yellow pages, but perhaps the best way is through personal recommendation from someone who has visited the practitioner before. Because acupuncture and Chinese medicine treat on every level, it is important that you feel comfortable and relaxed talking to your practitioner about your condition. As well as listening to what you have to say, your practitioner should explain to you in detail about the treatment being given. Will the needles be sterile? Yes, members of Acupuncture NZ are required to use pre-sterilized single-use needles, which are disposed of immediately after removal. How many treatments will I need? Generally, a course of treatment is accepted as being 8 to 10 individual sessions. Very commonly your condition may resolve in fewer than this, but if it is a long-standing condition, then it would not be unexpected to require considerably more. Initially you may be asked to attend for treatment 2 or 3 times a week, and then as symptoms improve, weekly treatment would be likely. Your first appointment may last for close to an hour, but subsequent visits may only take 30 or 45 minutes. Is there anything I should advise the practitioner? Most acupuncture practitioners will ask you to complete an information sheet on your first visit. The questions asked will cover basic information such as your name, address and age, the reason for your visit and how long the condition has been present. They will also ask about any medication you may be taking and whether or not you have had any surgery, even if it is not specifically related to the reason for your visit. You should also advise the practitioner of any of the following conditions: pregnancy, bleeding disorders, diabetes, any form of cancer, hepatitis, HIV/AIDS, epilepsy or seizures, skin infections, heart conditions, especially if you have had a pacemaker inserted. Do acupuncturists also use other forms of treatment? Acupuncture is just one aspect of Chinese medicine. A typical treatment may also include the use of moxibustion, the burning of a herb close to acupuncture points or on the needles, gua sha, scraping of the skin to cause slight redness, tuina, a form of massage, or cupping, the application of vacuum cups to the skin, most commonly used on the back. Your practitioner may also give you Chinese herbs to take. These are traditionally prescribed as dry herbs which are to be boiled with water. In more recent years, herbs are becoming more available as freeze-dried granules, pills, or capsules which are very easy to take.